12 months since COVID-19 emerged as a global threat, Pfizer's vaccine could be cleared for use in the United States within hours. 24 independent experts will debate the safety of the vaccine during a live-streamed public event. The decision will come as the country records 3,000 deaths in the last 24 hours, a new high. The next step will be distribution. The U.S. plans to ship close to 3 million doses of the vaccine by the end of the week. Pfizer's inoculation has to be stored at minus 70 degrees, which poses a logistical challenge.
Nick Harper is live outside the FDA building in Washington and joins us for more on this. Nick, we can hear the sirens in the street. Sounds like lots going on, but get us up to speed with what the status of the vaccine. Is it all but certain to be approved?
Yes, Steve, it's certainly going to be a busy day here at the Food and Drug Administration. There'll be a 9-hour meeting taking place in the building behind me. Most of it will be taking place online, though. It'll be video conference of 23 experts, doctors, professors, infectious disease experts, all of them weighing in on what they feel are the next steps for this vaccine. During that meeting, they'll also hear from the public, an hour Q&A session. And at the end of the 9-hour meeting, those 23 experts will give a recommendation. It's an advisory committee to weigh up the pros and cons. They'll pass that recommendation on to the main FDA, and the main FDA body will then make their final emergency approval decision. That could come at the end of today. It could be another couple of days before we get that. They'll be deciding whether or not to give emergency authorization to that vaccine. And then, of course, the rollout would need to take place, which will be a huge operation. As you mentioned a moment ago, they're looking to try and get 3 million vaccines out there during the course of the next week or so. But bear in mind that there's 330 million people right across the United States. And the idea will be for the government to get a vaccination program underway that covers all of those people. That rollout will be very difficult. There will be logistical challenges, and it'll be made even more difficult by the fact that they need to store those 2 doses that each person needs at very cold temperatures. So this is certainly the next stage in that whole operation, but there's potentially a long way to go before the entire US population is vaccinated.
There is some level of urgency, though, here, isn't there, Nick? I mean, another day of record cases, and experts are warning that it is going to get even worse. Could harsher restrictions then be back on the agenda to help ease these numbers?
Well, Steve, that is certainly the huge possibility at this stage. We've already seen lockdowns take place in the state of California. They started on Monday. More than half the state, about 20 million people, currently under very strict lockdown conditions, which will last for at least a month. But the thinking is that things will get worse. We're told that the peak of deaths and infections are likely to hit around the 3rd week of January. That is the same week when the new President Joe Biden will be inaugurated. We're already seeing hospitals nearing capacity. About a third of the US population, about 100 million people, their local hospital is now nearing capacity, meaning that the ICU beds, those intensive care wards, are filling up and filling up fast. And we saw that new daily record for the number of deaths. 3,000 people dying in a single day. Just to put that into perspective, that's more people dying from COVID-19 than died in the 9/11 attacks in 2001. We're seeing huge numbers of people dying, and that's happening on a daily basis. And the big fear is that things will continue to get worse as we head into this holiday season. We've just had Thanksgiving. People are now traveling, students coming back from colleges and universities. We've got Christmas just around the corner. There is another big travel period ahead, and everyone is warning that people should not be traveling, but that is unlikely to happen. So the fear is we will continue to see those infections spread across the country.
Okay, many thanks for giving us up to speed. Nick Harper speaking to us from Washington.